All right, here's what we have on this next case. Starting with the images, of course, we've got a lateral radiograph of the right ankle and hind foot. The first thing that jumps out at me is the grossly abnormal appearance of both the ankle and hind foot joints. This is not your typical joint structure. There's a fracture dislocation involving the talus, with a notable loss of congruity at the talonavicular joint. It's not aligned properly, and I can also see that other joints around the region, especially the subtalar joint, seem to be out of place. This is always concerning. But that's not all. I can see a fracture running through the cuboid, with additional bony fragmentation in the calcaneocuboid joint. The entire area just screams instability, with remnants of the subtalar joint being completely disorganized. Something else caught my eye. There's some subchondral sclerosis, but the bone density looks otherwise normal. That's a clue. Also, soft tissue calcification is visible posteriorly, which could be a result of long-standing vascular disease. Vascular calcifications are also present, giving us another clue about the patient's metabolic state. So looking at these findings, I can't help but suspect that this might be a case of neuropathic arthropathy. Now, we know that this can be seen in people with a history of diabetes or spinal cord abnormalities, like syringomyelia, right? If the patient reports no pain, but there's a warm, swollen joint, I definitely lean toward neuropathic arthropathy over something like septic arthritis. This is especially true with the involvement of multiple joints in the ankle and foot. Septic arthritis is generally monoarticular, so that makes it less likely in this case. However, if the patient has a history of severe trauma, we'd also have to consider whether this represents an acute injury, potentially in a patient with vascular disease. The vascular calcifications add weight to this possibility, so we'll need to keep that in mind too. What would I do next? I'd definitely ask for another orthogonal view to get more detail. I'd also discuss the case with the referring clinician. Given the possibility of an infection complicating things, maybe there's an infected collection, we might need to assess this further with MRI. Especially in cases like this, you want to be sure you're ruling out osteomyelitis. All right, so what could the examiners ask you? Well, they might quiz you on the distinguishing features between neuropathic arthropathy and infection, like septic arthritis. We know that septic arthritis tends to be monoarticular, whereas neuropathic arthropathy usually affects multiple joints. They could also ask about the characteristic radiographic features of neuropathic joints: distended joint capsules, debris, dislocation, destruction, and degeneration, what we call the 7 Ds of neuropathic arthropathy. The involvement of weight-bearing joints, like the ankle here, is pretty classic, especially in patients with diabetes. You might also get a question about the differential diagnosis. What else could look like this on imaging? Spinal cord pathologies like syringomyelia can affect the shoulder in a similar way, and other causes of joint destruction, like congenital insensitivity to pain, syphilis, and leprosy, should always be in the back of your mind, though they're rarer. And that wraps it up. Remember to hit that subscribe button for more radiology cases like this one. Stay tuned, and I'll see you in the next one.